Good evening, everyone. Welcome to Your Health Matters OC. I am Dr. Clayton Chow, Healthcare Agency Director, co-host for this show, and this is Dr. CK. Say hello.
Hi, I'm Dr. Regina Chinseop Kwong, also known as Dr. CK, your Deputy Health Officer.
And tonight we have with us Miss Rachel Ferriolo. Say hello.
Hi. Thank you so much for having me. My name is Rachel. I am a licensed clinical social worker with mental health and recovery services.
Okay, so this month is the social worker month. And I know the board of supervisors just did a resolution this morning for social worker folks.
Yes.
Thank you to Rachel for joining us, but on behalf of the community, thank you for what you do. And I know people think of social worker and sometimes they scratch their head and say, well, what exactly does a social worker do, right? In Orange County, in many counties, social worker has become really an important, the energy that I used this morning is, I believe that social workers are like the stitches that really repair all the holes in the fabric of society, right? So I hope you guys appreciate that.
And I know you do. Thank you.
Social worker in Orange County have performed every single work and involved in every single department, right? From public health to mental health to correctional health to even administration. One of our chief of staff is a social worker, and he makes sure that I mention that. So the opportunity for individuals who go into this field is just vast, right?
It is,
So
yes.
tell us specifically what is it that you do
Sure.
in your role?
Yeah, so I supervise and manage our disaster response team. So we're a group of volunteers in mental health and recovery services, and we provide support to the community. So after a crisis or some disaster, obviously the last 2 years we've been very busy and had the wonderful opportunity of being able to support individuals at the point of dispensing of the vaccination sites, where we were able to offer support. And I think considering the anxiety surrounding that last year, it was really nice to be able to have clinicians, social workers, and just people committed to helping out there, reminding people that, you know, they're human and there's different things that they're might be experiencing, and that it was okay.
That's great. So that is a great, perfect point to start the topic for tonight, right? And that is mental health throughout this last 2 years, the pandemics. But before we go there, I just want to remind people, if you don't know, today is Women's International Day, right? International Women's Day. So I got two professional women here with me, and I know in the healthcare agency, as the county agency and other agency, we are really want people to be aware of the contribution of the women in our community, of our country and the world, especially during this last 2 years. I think despite the difficulty with juggling with all this guidance, taking care of your children, especially during the lockdown period, many of our staff, women's staff, has been really crucial in the work that we do here in healthcare agency. So for those of you women who are staff of a healthcare agency, thank you. And for the women professional who provide the really crucial work in all area of our economy, right? From supermarket to management to you name it, healthcare provider in the hospital, in the clinic, first responder, in the law enforcement side as well as EMT side. We have a lot of women participating in this. So thank you so much for the work that you do. Dr. CK?
Yeah. I would love to thank all of my mentors, because it takes a while to get to the point that we're at as females, and have so many mentors that have brought me here today, because they were such strong women who were able to have their children, have their job, yet be such wonderful examples in the workplace. I had great mentors in medicine and residency, but also mentors in public health and at home. So thank you to all those women, and to those little girls who are out there, including my nieces. The opportunities are so vast and wide for you now today because of the women who really forged ahead these opportunities for us. So we're so very thankful.
So you have a woman physician, you got a woman crisis response person, right? Leadership role. So this is fantastic. And so if you didn't know or not aware, Dr. CK, who's currently is our Deputy Health Officer, will officially be our health officer this Friday. The board just approved it this morning, so that she's taking off one of the hats that I wear. So thank you so much. You joining us since November 2020, in the middle of the pandemic, and I think that was the beginning of our winter surge. And she gracefully accepted the challenge and come, because I don't want to speak for you. You can tell us why you come and join the healthcare agency.
Oh, definitely. And you know, it was a hard decision. I think we were at a point in the pandemic where before the vaccines were here, it almost felt like there was no hope. If anyone remembers that spring of 2020, and I knew that vaccines were around the corner and so much more needed to be done. We were testing a lot of individuals in our clinics, and even more needed to be done. And I knew that the only way to get out of this is to really encourage people to get vaccinated, because I don't know, when I looked at the numbers and inflammatory markers that were raised significantly high with COVID, I was really worried about the long-term impacts. You know, even if we didn't have the data yet, if you understand medicine, when you have inflammation in every organ of your body, you're looking at a lot of chronic diseases that will follow. That includes Alzheimer's, that includes diabetes, that includes hypertension, you name it. And I was already taking care of a lot of patients who had a lot of chronic conditions that weren't resolved. And all I was trying to do was reduce the inflammation. And so this virus comes to town and significantly rises the inflammation. There's nothing else we can do but protect our county. And so I made that leap of faith after really thinking about it, and after also some encouragement from some other colleagues in the field of public health and medicine. So thank you to all of you. You know who you are, who helped me get here and get to this point. Also, thank you to my family for supporting me, because it wasn't an easy decision.
But I'm glad you're here.
Yes, and I mean, we did so much, right? We were able to raise those super pods. Working with Rachel back then, her team made it so fun to go to our super pods and get vaccinated. I remember her team of social workers came out there with their Mickey Mouse hats and really like some balloons, and they were really making the families feel safe when they were getting their vaccine. So thank you for your team. It was really helpful.
So there's a question that came in to our email address, and I'm going to take this opportunity to thank all of you who submitted questions through our email address. And let me remind you that email address again is yourhealthmatters@ochca.com. Again, I think the email address appears on the screen, but it is, we welcome you to send a question into us even during the show. So one of the questions that Monica sent in and asked, well, how many county health officers have we had since 2019? Actually, this Friday it will be 3. You will be the 3rd one, right? When I came in and took the role of the healthcare agency director at that time, we did have a health officer, Dr. Nicole Quick, and she was in her role for a few years, and then unfortunately Dr. Quick resigned, so I resumed over that role as a health officer as well as an agency director. I've been wearing a couple hats for almost 2 years now, so I'm grateful that you stepping in and officially will take that hat over from me. And so Dr. CK will be the 3rd health officer since the pandemic. So I think I answered that question from Monica. Before we go on, give us an update on the number, because we have seen some really bad number, right? Worldwide, U.S. and also locally in Orange County. So go ahead and give us some update number.
So the good news is over the weekend, our hospitalization rates actually reduced further.
In Orange County?
In Orange County. So our hospitalizations went below 200 over this weekend.
That's
and
great.
Today, we have 166 who are in the hospital with COVID and 28 ICU admissions. For the pediatric side, 9 kids are in the hospital with COVID and 0 are in the ICU.
That's great.
And again, still in the ICU, 86% are unvaccinated. And so I know there's a lot of hesitance out there, but those of you who are still waiting to get vaccinated, please make that decision to do so. And if you haven't caught up or got up to date with your vaccines, please get your complete your primary series, which may be 2 mRNA doses or 3 if you have moderate or severe immunocompromised, and then a booster dose 5 months later or 3 months later, depending if you're immunocompromised. If you had a J&J vaccine to start with, then if you're immunocompromised, we recommend that your second dose be an mRNA and then a booster dose an mRNA. So that's a total of 3 doses. But if you're not immunocompromised, we do recommend that you follow up with an mRNA dose for your booster if you started out with your J&J. And that will really hopefully protect you, as we know that more and more people are going out and about in the public without masks. In terms of our vaccination rates, we're slowly making some more improvements. Our age 5 to 11-year-olds are now, at least 30% of them are fully vaccinated, with 36% receiving at least 1 dose, but we still have a ways to go with that group. And then our 12 to 17-year-olds, 66% are fully vaccinated, and 73% received at least 1 dose. We have over 2,437,000 individuals in our Orange County who are now fully vaccinated, and 1,194,500 received a booster or additional dose. And our 65-year-old and up age group are still doing the best with their vaccination rates, with at least, I don't remember the fully vaccinated figure, but it was well over 90%.
It's close to 93%, I believe.
93%, and 99% received at least 1 dose.
Or 99.9, as Kurt pointed out. He rounded up to 100%, right? So that's a fantastic number.
Right. So, but unfortunately, globally, we did hit a grim milestone today, or around the day, depending on which numbers you look at. So globally, over 6 million individuals lost their lives to COVID, and that is likely an underestimate of the actual lives lost to
We know
COVID.
for sure. Yeah.
And in the United States, 955,958, or close, not quite a million, but close to a million deaths have occurred because of COVID. In Orange County, we are at 6,696 deaths from COVID.
Yeah. And 5
and
children under the 18, right?
5 children.
And so that's the piece that baffled me a lot, is that when we have that kind of number in a 2-year span, 6 million life loss globally, we know it's an underestimated number because there are some country at the peak of their transmission and death, people were just not able to count, especially a country that would very limited infrastructure as related to public health, right? Country where there's a lot of rural area that have really no access to healthcare. People were just dying left and right? So we know that number is undercounted. In the United States, we now have close to 960,000 deaths in 2 years. Let's pause for a minute and think about that number. 960,000 life lost in 2 years. Okay, that is not counting the number of people who are affected by that, because we do know that there's story of children ended up pretty much in foster care because not only their parents passed away from COVID, but the grandparents also passed away from COVID, and so they are left alone, right? We know in Orange County we're close to 6,700 people die now. I mean, those are not fake numbers, and it baffles me when people say, "Oh, COVID is not real," or "COVID is not that devastating," just like the regular flu. You cannot compare COVID to the seasonal flu. That makes no sense.
And we haven't even seen the actual long-term consequences.
Oh, we'll talk about that in a second, but let's talk about the grief and loss process for family that have lost a loved one, right? Especially family that lost youngster. Yes. I know in Orange County we had a father who's spoken publicly, and I'm so grateful for his courage to do that. I know he was on the news about a month ago talking about the death of his young daughter, 17 years old, right? So I'm so grateful. If he's watching, thank you for that public service, because it really speaks to one death is one too many, let alone in the children population. So how has our community been dealing with this issue of loss and grief for this last 2 years? What kind of trend have we seen?
Well, I think that we've all experienced significant loss, and whether it's someone in our family or just the universal experience that we've all kind of been watching and been a part of, it's very complicated. And I think why it's been even more difficult than pre-COVID is as we're trying to heal, right, through this grief process that is unique to every person because every person has a different circumstance, has a different background. But as we try to heal, there are more and more world and global events that continue to happen that are also significant, traumatic, right? So kind of re-triggering and making almost that healing process definitely not linear, but even more complicated. So I think that knowing that the process is going to look different for everyone, although it's a universal feeling, and that we can support one another depending on whatever stage that person may be in, and also know that depending on what happens in that person's life or in our world in general, that process may ebb and flow.
So Thomas sent us a question that there's different story as to the suicide death rate, right? In globally as well as the U.S. Throughout these 2 years of the pandemic, and that there's many stories. There's people who claim that the death rate, suicide rate increased, and he wanted to know, is it true, as particularly as it's related to teens? So I can say that there's several studies now in the U.S. as well as abroad, and looking at the suicide death rate globally throughout this last 2 years. And while in general there was not an increase in suicidal rate in general, so just want to make it very clear. If you look at generally, there's no increase in the suicide rate. However, when the U.S. look at the rate and teases out by age, there was an increase in suicidal death among young male in the U.S. From the age of 13 to 35, like 3 separate age groups, young male, but particularly Black, Hispanic, male, and Native American, Alaskan male. But there's a decrease in those same gender in the white and the Asian. There will be more study in looking at why that is, but you can probably look at the effect of the pandemic that in terms of the equity side, right? So we know that in the U.S. as well as many other countries, the ethnic group, there's certain ethnic group are disproportionately affected by the pandemic, right? Black and Hispanic here in the U.S. So we know it has a greater toll. The pandemic has greater toll in these populations, and so we can probably see that the compound from the social aspect, economic aspect that has in these communities that probably directly cause an increase in the death rate, right? So yes, Thomas, you are correct that there is an increase in teen suicide in certain male subgroup in our community, but the overall suicide death rate didn't increase. But I've heard that in the beginning, in the early on of the pandemic, there was an increase in call into the suicide hotline. Talk about that a little bit.
So
Rachel.
initially, in the beginning of the pandemic, we saw a higher volume of calls into our suicide hotline. That has decreased through time, but what we are seeing is an uptick and kind of this constant of individuals calling our warm line. So these are people calling looking for support. They may be having some suicidal thoughts, or again, kind of just looking for someone to guide them, link them to resources. And we see a very kind of steady volume of calls, some of which are related to COVID. But I think just in general, all of us, again, have experienced this sense of prolonged uncertainty, right? So a lot of unknowns. We don't know when the uncertainty is going to end. And I think when you add that into all of these other issues going on, whether it's familial, community, or worldwide, again, it makes things very complicated, and people sometimes need help managing stress. They need to know what is available, and I think that's why we're seeing people reach out. And I will say, one thing the pandemic has done is, I believe, and what I think my colleagues have seen, is decrease the stigma associated with mental health treatment. Okay. People are more willing to access help, to ask for help, and we as mental health professionals, especially social workers, right, we want to advocate for those individuals to be able to access the help that they need, and the Warm Line is a very easy way where people can start that process.
So I know for people in the community, if you have private insurance through your work,
sure,
most private insurance also have what they call EAP, right?
Yes.
Employee Assistance Program, that would offer limited counseling session, and that's pretty much a requirement for all employers, for the employer. So you have access to that, so you can contact the EAP, and then if you need more session, then they will refer you to the mental health benefit under your insurance. So most people have coverage for mental health, right?
Yes.
But for the general public in Orange County, what kind of phone line or access do we have for our community? Can you talk about that?
Yeah, of course. So a few years ago, we created OC Links. So we wanted to make, again, accessibility easier for the community. So we have it's kind of a one-stop shop where individuals can call one phone number, and they are connected to a live person that we call them navigators. So these mental health professionals are able to ask questions, kind of assess a person's needs, and rather than having the community try to sift through hundreds of different programs, the navigator can help link them with the appropriate program, so that individual doesn't need to know criteria, doesn't need to call several different phone numbers. And that navigator, if it's in business hours, will actually link them with a live person at the program. And even if someone calls that has insurance, the navigators can still assist and try to help that person, because we know that systems of care can be burdensome, and we want to try to alleviate any of those barriers and not let that be the reason someone doesn't access treatment.
So as Rachel described these lines, I think we have it post on our channel all the numbers. So earlier you mentioned a little bit about the Warm Line.
Yes.
Share with us the other lines that are available for the community.
Sure. So we have a Warm Line, the suicide hotline. We also have a line specifically for veterans, and the Trevor line for LGBTQ communities. So depending on, hopefully the idea would be that there's no wrong door, that an individual can call any number of these lines and get immediate help with a live person. And for individuals that are struggling, I think knowing that there's that ease and that someone is on the phone ready to listen and ready to help, hopefully it encourages people to try that.
Yeah. So earlier you talked about, I think you were hinting at the long COVID syndrome or long haul syndrome. I think there's a new name now, right? These are phenomena that we have observed in individuals who were infected with COVID, and the effect it has on their cognitive function, their brain function, as well as the emotional well-being. Can you talk a bit about that, Dr. CK?
Yeah, so even before COVID, like if anyone had, especially kids actually, when they are ill with a virus, there's actually a potential for them to have significant depression, anxiety, and there's certain syndromes related with that, or even psychosis that happens after that acute phase. And we actually started seeing this also through COVID and about months after someone was ill, even with a mild illness. And now we're starting to see the data really come out. Actually, a more recent published study showed that in the people who actually had a pre-MRI or picture of their brain done before they had COVID and had the same picture done after COVID, even with a mild illness, you already see parts of the brain with decreased density. And specifically the parts of the brain that are related to emotion and decision making. So it's not surprising that there are a significant portion of people who, after they've had COVID, have difficulty with memory, maybe a little bit more anxious or short-tempered, have difficulty sleeping. We see that in children. And the range of how many people have continued symptoms 3 months out after COVID is anywhere from 30 to 60%, depending on what study you look at. And again, it's really concerning that this is already occurring in many people, and we again don't know the long-term impact of that.
But this is not news, right? This is not new news. I remember back in even July or August of 2020, there were reports that people experience not only the shortness of breath, the physical effect of COVID, but there were reported people who experienced emotional effect of the COVID, right? And these are people prior to being infected, there was no sign, no symptom of mental illness at all, and a lot of them. I think somewhere about a quarter, now the statistic is about a quarter to a third of the population who were tested positive with COVID ended up having a long-term effect beside the physical symptom, but they're talking about the fogginess, right? And they're not able to concentrate, especially as the day go on. People get fatigued, not able to concentrate. People develop anxiety and depression, right? And memory problem. I think we now also seen it in children, right? And that's the piece that I always talk about. And this whole debate of whether or not children is greatly affected by COVID, we are able to demonstrate definitely there is a brain change that occurs, especially I worry about young brain that are affected by COVID. We have seen children who was hospitalized for psychotic symptom, right? So for those of you who don't know what psychotic symptoms are, a kid develop paranoia, they were seeing things and hearing things. And there was one case here last year where, again, thank you to the parent of that child who publicly talked about the psychotic episode that their son were experiencing, and this is the family that did not have any history of mental illness prior to this, right? And so what's frustrating is then suddenly every children's hospital almost in the country beginning to talk about, they did have experience with children who was admitted for psychiatric condition, right? So we know it does happen, right? And so yeah, and we don't know what is the long-term future for this kid, right? Will they recover from this symptom? What will be the residual problem that they will continue to have as time goes on? But let's speak to the effect of COVID on the emotional well-being of the community at large. Let's break it down by age group, right? So in general, in the young adults, what do you see? What kind of call that you have to intervene with, or our system experiencing with, Rachel?
Well, I think you mentioned it. So just a lot of anxiety and worry. I think when people, especially whether it's teens or young adults, are trying to navigate the world and form their identity, and a lot of times that's through interaction with their peers, through activities, they're learning about themselves, they're learning about others, and COVID didn't allow for that to happen in what we know is a natural way. So I think that not being able to kind of have that foundation, or at least something that they can count on or look forward to, again, that has caused a lot of difficulty as people are kind of developing their identity. So the anxiety, particularly for that group, I would say is what we're seeing most. Luckily now that kids and young adults can start returning to doing normal activities and really, just things that they enjoy, right? That allows them to interact with their peers and learn and be in an environment, in a school environment, right? Where they can learn through others and have mentorship through teachers, things like that.
So that's important. But before we go on, I just want to remind the community that please, if you have any question for us, send us an email at yourhealthmatters@ochca.com. yourhealthmatters@ochca.com. I think earlier before we start the show, we were just talking about as human, a social animal. I think that the lockdown period that we had to enter, because at that time we didn't understand much about the virus. We didn't have option like some of the new therapeutic that we have, medicine and the vaccine. So we had to go into a lockdown. We are social animal. Definitely that was not good for anybody's emotional health by all means, right? I mean, I know I yearned for hugs, I yearned for friends and what have you. And so it not only has an economic impact, but it does, I believe, did have an emotional impact. And it's not just in the U.S., we see that worldwide. And so the bottom line is the lockdown should be the last, what do we say? The last effort, last resort, right? Resort. So we as a community have to do other things to ensure that we will never go back into the lockdown, right? Because we know that does affect us. Let's talk about the senior. I know the senior population suffered the most, right? I know because my mother lived with me. Oh, sorry, she's watching. Sorry, Mom. In my culture, it doesn't matter how old you are. If you share the same household with your parent, you live with your parents, even though you pay for the mortgage. It's not the other way around. So sorry, Mom. Yeah, I live with my mom, right? And so I know it took a great toll on her emotional well-being, right? Because isolation is just not good for our senior. So share with us story and the effect on the elderly population.
Sure. So older adults, COVID presented very unique and complex circumstances for older adults, not only in the physical health realm where they had worried obviously about getting very ill. The COVID restrictions and precautions like quarantine, isolation, led to a lot of older adults reporting sadness, loneliness, worry, and again, it wasn't easy for them to use the means that were provided, such as technology, right? A lot of older adults either never used that, didn't have anyone to teach them because they couldn't have anyone over. So it presented a lot of challenges as far as presenting opportunities for them to continue interacting in the world. And we do know that reports now, older adults are saying that because of the pandemic, they actually are more likely to reach out and seek help, which we want to capitalize on that, right? So I think older adults are noticing that being able to be physically active, connect with their community, whether that's in with the spiritual realm or going to the community center, that these things have a huge impact on their overall well-being and how connected mind-body is, right? So when they take care of their mind, their body, then they're feeling maybe at their best, right? And able to do things that they enjoy. So again, as mental health professionals, we want to increase accessibility. We want to make it easy for older adults to reach out for help and be able to have them create connections with clinicians so that they can talk about some of the things that they experienced. because again, with isolation, they weren't able to share these things with people.
Yeah.
So now is the time. It's never too late to kind of look at what they've been through and work on coping skills and long-term resiliency.
Yeah. So if you just joined us, this is Your Health Matter OC. This is a talk show that we just started every other Tuesday night. My name is Dr. Clayton Chow. I'm co-hosting this talk show with Dr. Regina Chincio Kwan, Dr. CK, and tonight we are talking with Rachel Ferriolo, one of our mental health crisis specialists here in Orange County, leading our team of crisis respond here in Orange County. So we're just talking about the emotional toll on our senior. I know my mom is in her mid-80s. This last 2 years really took an emotional toll on her, right? Not being able to see her grandchildren. And I have to preface by saying, even though I live with her and I have 2 other family members live with her, we live together, 4 of us, but she is an immunocompromised person, so we've been extra careful in not allowing her grandchildren to come and see her because, you know, they are at the school age or they're working and some of their colleagues might not be vaccinated, so we want to be extra careful. So I know it has taken an emotional toll on my mom, and then because of the inactivity, like you mentioned earlier, her muscle tone decrease, her muscle atrophy, right, got smaller, especially her leg muscle. She's very weak in walking, and come to find out, there's many seniors that way. So I was particularly touched by the senior who were living in like nursing home and what have you. There was periods where we didn't allow the family to visit them because fear of the outbreak in the nursing home. Share with us what was happening there from a family doctor perspective. How would that, I mean, it must be hard for you.
Right. So, I mean, in the hospitals and skilled nursing facilities, long-term care facilities, I mean, it's many of you probably already had a family member who had to be hospitalized or had some event where they needed to be in the hospital and you couldn't visit them. That's detrimental to anyone's healing. And, you know, some people also passed away in the hospital without their family close by, and that is just so detrimental to the family, as well as the person who actually passed away. It's hard as a physician when you are trying to care for someone and want that emotional support from the family or, you know, the loved ones to be around them, because having that social connection is so important in healing. You can't go without. We are, like you said, we're social beings, and hopefully in the future we're going to get to a point where we find, if for whatever reason we get to another variant that affects us, we get to a point where we still will honor someone to visit someone who's hospitalized. And I know that skilled nursing facilities and hospitals are now having visitors. I know the nurses were really good patient advocates and really trying to make sure they were, as soon as they were able to have family members come in, allow that to happen. So hopefully in the future we won't have to have those restrictions. But again, having family connection is so important to overall healing and well-being.
But even with the mask mandate that has gone away for the general public, right? How do we advise the senior what to do? I know we in Orange County has always shared with the community that know your risk, assess your own risk, and take the proper precautions measure to protect yourself. Like my mom, I think I shared last time that we were able to convince her to get her 4th shot because she's somebody who's immunocompromised, and this weekend is 2 weeks out, right? And so we're looking forward to, okay, let's just take her out and enjoy dining outside of the home, because she enjoyed that. My mom, all her life, my family, all our life, we enjoy dining out and that sense of community, right? And so I know she misses that. But this last 2 years, she developed this fear of going out of the house. And I know a lot of our senior fearful of that, right? And now that the mask mandate no longer in effect for the community because of transmission is lower now, according to the CDC last Friday, Orange County have low community transmission, right? But there's risk. There will never ever be zero risk. There'll always be risk. And so that's the piece that we want a community to know is assess your own risk and do all of these measures to protect yourself. Like I wear a mask today because I know I'm extra careful because I have somebody who high risk that I live with, right? And so when I go to the supermarket, I wear a mask. When I go into the store, I wear a mask. When I walk outside in a crowded area, I wear a mask because I don't know what other people, whether or not they vaccinated or not, or whether or not they have the virus, right? Because we do know, especially with the Omicron, people who are asymptomatic might not get tested and might not know that they're infected, especially with Omicron, right? And so I wear a mask. I know my own risk. I know the risk that I really exposed my mom to. So I do appropriate things. What do you think for a senior?
I think it's important to take all of that into consideration and still layer up on the protection. You don't need a mandate to wear a mask, right? So if you know the data that yes, there's still variants out in town, and while there's new criteria for categorizing a community of low, medium, or high, when you actually compare the transmission rate, just the transmission rate itself, it's still pretty high compared to prior to Omicron. So that being said, the good thing about being in Southern California, the weather is warm. And we know that good ventilation does help and is a protective measure. And so I think it is around that time where even if you're immunocompromised, again, we talked about that social connection is so important. It's time to meet people, but meet people in the way that you feel protected. So that may mean eating outside. A lot of restaurants have outdoor lunches, or you can eat and spread out. If you're going to eat in a restaurant, some restaurants still have some distancing measures, so you can do that. Or you could just limit your time in that restaurant and wear your mask when you're not eating. But also mind your mask. You don't want to keep touching your face and then expose yourself by touching your face. So I don't know. I think for me, the mask will probably be part of my regular item that I have on me all the time because we're assessing our risk as well, and we have the grandparents want to make sure the kids can see them, and the kids are always exposed to other kids. So the other thing that we talk about is making sure kids also understand that they play a role in also protecting their grandparents, and what they do matters. So luckily my kids are smart and have been listening to everything I've been saying, but I understand that there's some, they want to hang out with their friends. So I'm not sure what's going to happen after March 12th, but I'm hoping that they've been listening well enough to know that there are risks involved if they decide to remove their mask in close setting with their friends.
How do parents talk to their children about all of this, right? It's not just about the mask issue, but the effect of COVID, in school and public. What are some tips?
Well, first I want to remind parents that they know their child best, right? So being able to take into consideration a child's temperament, their developmental stage, and also just their ability to kind of comprehend information, that parents can make the choice to deliver the information in the way that they feel their child can accept it and be able to engage in the conversation. Because I think it's not only important for parents to give honest, accurate facts, but they need to provide an environment where a child feels safe enough to express any type of emotion and reaction. And, again, going back to just being human and being vulnerable and knowing that there is a lot of emotion attached to mask, to everything that's involved, and that parents, the signs and signals that they give their children are important as well. So if parents don't know an answer, it's okay to say that they don't know, right?
And look it up together.
Exactly, yeah, and speak to people that they trust, and look up information from, sources that, have accurate information. I think another piece too is reassuring children that depending on the conversation that they have choice and they are able to do things to keep themselves and their community safe, but also experience life, right? And those choices that the family decides in the conversation may look different from their peers or their friends or their neighbors, and that is okay, because we're going to respect other people's choices, but knowing that whatever is decided in the family was decided because it's best for their particular circumstances.
But there's a lot of, there's a lot of noises in the community
Sure.
around the mask. You have parents who said yes, you have parents who are against the mask. So you have two youngsters at home. and take the physician hat aside, from a mom perspective, how have you been communicating with your two sons?
So I'm hoping they're listening because I'm hoping they heard what Rachel said. But yes, as a mother, of course, I'm always going to try my best to get them on my side. But I have to also be graceful enough to be okay that they also have the choice to make for themselves. And I'm hoping that they make the good choice to not get infected. Because again, I'm still concerned that even if you have mild illness, that there are long-term consequences that we don't know yet. And I want the best for my children. I want them to thrive. I want them to be successful and dream up and follow their dreams. But to do so, they need to do well. They need to be functional with their peers. I can't have them having sleep issues. I can't have them, not being able to think. I don't want them to have a chronic headache, right? I don't want them to experience that multi-system inflammatory syndrome. That would hurt any parent, right? If you had to see your child in the hospital. I think as a parent, I want the best for them, but I realize that and I've heard my kids say that this is restrictive, but what I have seen is that they have been able to function with the mask as well. I'm so proud of my youngest one who has been so physically active because with all this messaging, he has been so diligent about wearing an N95 mask, even in high intensity sports, indoors and outdoors. And I know that takes a whole lot of courage in front of his peers to keep that up when a lot of his peers are not doing the same for many different reasons.
But let's talk about the fact, though, because
Yeah.
there's a lot of misinformation
Yes.
out there. Okay, the question is, does the mask work?
The mask does work, and actually a recent study was published. It was actually done in California, and it showed that wearing a highly effective mask, so a KN95, N95 mask, actually reduces your potential of getting the infection by 83%. And then when you go down to a surgical mask, then it reduces it by 66%. And then if you go down to a cloth mask, you're at 56%. So there's a significant decline in the efficacy depending on the mask that you wear. So the type does matter.
But most importantly, a mask is better than no mask. We know
Right.
that, right?
Right.
If you think of the lowest level effective mask, the cloth mask, that gives you 56% protection, and you layer it with other measure,
Right.
like if you are in the public where it's crowded and you don't know people, put on your mask, right? The vaccine as an option, right? So you layer that up, you have a very good protection,
Right.
especially for individuals who are at risk, right? That's the piece that people need to know, and I would hope parents would talk to their children in terms of respecting the individual choice, and that is, don't make comment, don't joke around friends who wear masks, because you don't know what the situation is. I know I have a niece who is terrified of getting infected, right? She's 13 and she's very conscious with the mask, and she's wear it all the time, right? And her group of friends are like that. But I've heard of school this last month or so where there was a scenario where kids making fun of other kids for wearing a mask, right? So we want to make sure that kids learn to respect each other. The other myth is that there was some accusation that masks cause a depletion of oxygen for people who wear a mask, especially youngster. Is that true?
No, it hasn't been proven. I know that maybe if you have another condition that may do that, it may do that. But I mean, I think the first time I heard it, I was scratching my head because I was thinking, if that were really true, then all of us physicians who had to wear, and the nurses and the clinical staff who had to wear these masks for 8+ hours straight, then, I mean, how did we get to where we are at this point? We must have been deprived of oxygen all that time.
Right.
We can't
Sorry,
be
I don't mean to joke, but yeah, that's
Right.
just ridiculous information that's been setting out there.
And there's other occupations that require heavy-duty masks, right?
Yeah.
Miners,
Yeah.
people who work with metal, they have to wear a really good,
Yeah.
well-fitted mask. And so you can't discount them as well. They've been able to survive with the mask that
So
they have
the
to
answer
wear.
is no. Wearing a mask does not deprive you of oxygen.
And I think of it like sunscreen, right? Like the sun, UV light can cause cancer, and we use sunscreen, right? But you can also use even more protection. You can wear sun, protective clothing. So the mask is almost a similar situation where you're really protecting yourself from getting infected by putting that extra layer.
But from a child, a youngster perspective, all of this changes in guidance, right? Mask on, mask off, do this, do that. What does that do to a young child's emotional well-being?
Sure. So transitions are anxiety provoking in general, right? And I think when you're raising a child, one of the things that parents try to do is help to maintain a routine. So children know what to expect. It helps in their development, kind of their mastery of skills. And I think with this information of back and forth, it's made it very difficult. I think in the explanation area of being able to talk to kids about why is it this one day and why is it this next. And although we can't control that, I think parents, again, what they can do is continue to reassure kids that they are listening, they're there for their kids to be able to express concerns, or if they have questions, if they're experiencing things at school where kids are making comments, that parents help develop that self-awareness, right? And that ability to kind of protect themselves or talk to a trusted adult. Again, although, yes, it must be very difficult for children to try to even understand what's going on. As adults, it's difficult, right? But as parents, kind of keeping that consistent presence, that loving atmosphere where children feel that they can develop their own sense of self and safety, it's really, it can make a very huge and powerful impact.
Now, I know there are parents who are happy that on the morning, the crack of dawn on this Saturday, the 12th, the mask mandate for school from K to 12 will change from a mandate to a strongly recommendation. And I want to make it very clear that strong recommendation is very different from optional, right? So strong recommendation really send a message that you really have to evaluate your own risk, the risk of your community, to make the appropriate choices, right? So for those parents who actually want their children to wear a mask and want their children to be well protected, what do you say to them?
Yeah. So kind of how I mentioned earlier that although it may look different to their peers, some of their friends or neighbors may be transitioning away from masks, that explaining to children the reasons why their family has decided to continue masking. And again, that being in disaster preparedness, I think what's so important is talking to kids about possibilities in the future, right? So I know a lot of situations have been connected to wearing a jacket, right? So we may not have to wear a mask now, or we may see people not wearing masks at school, but that may change. So knowing that things will continue to ebb and flow, but that kids, again, there's a constant where they can come back and be able to feel understood and express what they're feeling in their own home, and also speaking to like groups of friends, right? So identifying individuals in their class, at school, who they feel safe with, who they trust, because that emotional support isn't just from parents, right? It's also from individuals that are the same age, and teachers. I know, I mean, just huge shout out to educators and individuals who have been so wonderful in supporting our students and youth through this very difficult time. And I think knowing that they will continue to do that is important for kids to know.
So as a mom of two youngsters still in school, how do you prepare yourself for, I guess it won't be Saturday, March 12th, because there's no school there, technically speaking. So Monday the 14th, when they go back to an environment where mask is not a mandate, but a strongly recommended measure. As a mom, how do you prepare yourself to talk to your two sons?
We've been talking almost on a regular basis, so they get to hear all the studies from me when I see the studies, and we talk openly about what it means to wear a mask and what it does. And I understand it takes a whole lot of courage, and I agree with you that they have to surround themselves with friends who they trust and who they feel safe with. I mean, technically, this is an appropriate time for them to learn that your friends are the ones who support you, not the ones who backstab or don't support you. And it's a lifelong lesson to learn young. That it's okay to be different. But you also have to have that courage, and you have to have confidence when you do that. And I get it. When you're at that age, there's a lot of peer pressure, but just like everything else with peer pressure, the more confident you are in yourself, the more of a foundation you have because of family links and relationships and experiences, the stronger you're going to be able to stick to whatever decision you make. And it's actually a sign of strength to continue on to build or go on your path of what you think is right and hopefully safe for you. And it's not a sign of weakness at all. So, I mean, those are the discussions I'm having with my kids, but ultimately it's going to be their decision to make after the 12th. I have the luxury that my kids have spring break, so they get a week to decide for themselves before they go back to school.
So the 21st is when they come back.
Right.
So as a physician, I can tell you, it was very difficult, right, for me to accept the fact that as a community, as society, we're going to have to live with coronavirus, at least in our lifetime, especially when the Omicron just started to come out. That variant was it's a rude awakening for all of us, right? Because I think all of us, before the Omicron, was thinking that, okay, we'll have variants, and the vaccine will cover us. We know that eventually we need to get a booster shot. However, often in the beginning it was like 2 to 3 years, right? And then the Omicron hit, and we thought, oh my goodness. So we really have to learn ourselves to live with this virus for our lifetime. But I'm hopeful because children are resilient. That's the one thing about children that I love, is that they're so resilient.
And adaptable.
And adaptable,
Yes.
right? And so that's it. I think that this conversation today, thank you so much for joining us today, Rachel. I mean, it really speaks to this pandemic. Really, not only it has that physical effect on the community, the financial, economic effect on the community, but the emotional effect on pandemic. You can't put a price tag to it, and you can't really measure on the devastation, right? We kept talking about the pandemic of the emotional deprivation or emotional turmoil that people are getting in. But I am hopeful because our community are supportive of each other, right?
Yes.
I'm hopeful that we have resources to provide for all ages, but I'm hopeful that family would come together and have frank, honest conversation and make decision with each other, assess the family's risk, and then do the right thing. Because thank God we're now in year 3 and we have option, the vaccine. And I still say that's the only way to get us all out of this pandemic, right? And not just in the U.S., but global, because we do know that globally there are countries that are not having resources like the vaccine readily available for everybody. Was in our country, we are fortunate to have access to vaccine for everybody if they want it, right? So that's the question. So we have to continue to educate the community on assessing your own risk and do the right thing for your own family, for your neighborhood, for your community, right? So thank you so much for joining us again. 2 weeks from now, we're going to come back, and the topic for 2 weeks will be colon cancer, among other, but mainly we're going to concentrate on colon cancer because March is colorectal month, and so we'll have a specialist who come and talk to us. So between now and then, if you have questions about colon cancer, please send us an email at yourhealthmatters@ochca.com, yourhealthmatters@ochca.com. I'm hoping that you will invite your friend and your family to watch this show. I hope that we bring value to your family conversation. And basically that's what I'm hoping, that we particularly pick 6 to 7 so you can have dinner and watch us and continue the conversation among yourself, in your family, in your circle of friends, in between shows. So thank you so much. This is Clayton Chow and Regina Chinseo-Kwan, your co-host for Your Health Matters OC. I hope you enjoyed this episode of our conversation with Rachel. And we'll see you next time. Have a good evening. Thank you.